This is Dan Smith from Belleville. He's the fire chief in Belleville, and some of you may have read in the news that Belleville had to declare an emergency when they had a spike in drug overdoses over a short period of time. And so Dan has been at the center of all of that, and he's graciously agreed to come and share their Belleville's experiences with that. So Dan, I'm just going to turn it over to you, and the floor is yours. Thank you very much.
I can just give a little bit of an overview on what led up to us declaring an emergency, why and how we declared emergency, and kind of what's happened since then. I'm not going to get into a lot of the statistics with regards to overdoses. The newspaper hammered those, the local media, national news, they hit all of that. Those are really hard to trigger. Stats were coming in from my team within fire services. They were coming in from our EMS partners. They were coming in from the hospital and coming in from police. So there's a very good opportunity there for things to change. So numbers were very fluid throughout the real height of everything. So I guess where it all began, like many of you, our community suffered from mental health, addictions and homelessness, and it's been going on for a number of years. We're not unique across the province. Our community is just like many others. Last year, so in 2023, late in the year, we actually we hosted a mental health and homelessness summit. Things were ramping up in Belleville. Homelessness had become a problem over the last number of years. People just couldn't afford their homes. They were losing their homes, and it was attributed to many, many different factors. So we kind of raised the flag last year. We had members from all different social services. We had the province there, other communities there, and it was a great turnout and a really good planning event. Fast forward to February 8th of this year, we declared an emergency. Things did not get any better. In fact, they got much, much worse. You would have saw things in the news. We were local news. We were provincial news. We were national news. If you went onto yahoo.com down in the US, you were pulling things up. We received requests for information from places down in Chicago, Rochester, all over the place. Not the kind of news that we wanted. Headline news in the Toronto Sun, for anybody on here that's involved in crisis communication, we were referred to as Hellville. Not a great handle for our city, not a great handle for our mayor to get out in front of, and for the rest of us in public safety to have to deal with. So on February 8th, we declared that emergency, and that was a decision that was made by our mayor. Our mayor is the one that declared the emergency, but it was in consultation with myself as the emergency manager for the city, with our clerk, with our police chief, with our CAO, with numerous councillors. It was not an easy decision to make. And everybody said, well, why? Why did you declare an emergency? Normally people declare these for things such as a flood, a tornado touching down. We've seen many communities do these, maybe a major explosion, but for something like this, it seemed odd. And so what I promised to do here tonight was to explain why. So Emergency Management Ontario, they've got a checklist that emergency managers such as myself will follow when we liaise with our mayors and our heads of council to determine whether or not we declare an emergency. And that checklist is quite long, and I've highlighted a few things that I can read off quickly. We checked off 6 of the boxes. So when everyone said, how could you possibly declare an emergency and based on what, we easily checked off 6. So for things such as exceeding our capabilities within the municipality and the deployment of personnel, we were tapping out our resources from policing, from fire services, and from our EMS partners at the county level. Did the situation create sufficient strain on municipal response capabilities? Absolutely. Does or might the situation require provincial support? Yes, it does. That one was the easy one. Does the situation pose a threat to the provision of essential services? So one of the reasons we were worried about this, we were getting a lot of flack from the community of, if you're dealing with so many overdoses, can our police still get to the robbery down the street? Can our fire services still get to the house fire down the road? And can the EMS staff still respond to my aunt who's having a heart attack down the street? So they were strained. We were still able to do it. We were splitting our resources, but they were strained. And one of the big ones, did the event attract significant media and or public interest? Our mayor, he's been a mayor for a long time. He went off and did a stint with federal, has come back to municipal. He's seen more camera time over the last few months than he has in his entire political career. And I think the last one, which some people think is a bit of a stretch, but it's the truth. Is the event likely to have a long-term negative impact on the community's economic viability? So the city as a whole, is it going to affect our economy? What it affects is local economy, the local businesses. So our homelessness and drug addiction and overdose concerns are focused in our downtown core. So if you're familiar with Belleville, we have a facility downtown. It's called the Hub. It's the former United Church, and that's where we're running a soup kitchen, a warming center. There's some social services provided there. It's a place for people to get out of the rain, and it's frequented every single day. It's in our downtown core, and so that brings things such as drug use out in the public eye. It's right around the corner from two schools, and it brought some concerns to local businesses as well. There was robbery, theft, nuisances, assaults. All of these things were happening in the downtown core. Some of it attributed to the population, that vulnerable population. Over the last few months, so since the beginning of 2024, we've lost 6 local businesses in our downtown core, and that's pretty significant. Whether they come back, we don't know. It is nice to see that we do still have some new businesses coming in, but it has definitely had an impact on the economy as well. So those were kind of our reasons behind declaring that emergency. And so when you declare an emergency, the first thing the province says, what do you want? So it was a 2-step process, and we liaised a lot with Emergency Management Ontario, and they have a formal process that is called a request for assistance submission. That's basically a letterhead from the mayor, and it outlines exactly what it is that we're asking for. Our first list of asks, it was like 12 items long. We wanted the sun. But what we did do in the long run, we narrowed it down to 2. There was 2 major focuses that we need. The bridge or the hub facility that was being used as that kind of soup kitchen, warming center, place for people to just get in out of the weather and receive some of those social services. It's over capacity. It was never designed for that purpose. It was a church. Another facility has been procured, and so far the city's dumped $1 million into it. There's been other private partners that have put forth a lot of money as well. We need more to get it up and running. Our goal is to have this facility up and running by the end of the year. So our biggest ask was to get help to get the bridge up and running. And then the second piece to that was investment in local detox. So we don't have any local detox centers in Belleville. Closest detox center is in Kingston. It's an hour away. We have no way of getting these people to Kingston. They have no way of getting themselves to Kingston. So there's no detox center, and we need those. So we put in those submissions, and because we declared that emergency, because of the local panic, because the media was all over the fact that we had those 13 overdoses in a matter of 2 hours, we became a hot topic, and the province was pretty quick to reach out. So after we submitted our asks, we quickly heard from an associate minister. He came down. We called a meeting, not just with the city, but with all the community partners. We had social services there. We had the people that are running our current warming center. We had all the people in the room that we needed together to be there so that the province could hear what it is that we needed. So at the end of it, what they said was, okay, we get it. you need this hub facility where we can get some social services, some warming center, some meals for these people. And yes, you absolutely need detox, but you need more. So what the province calls it is a continuum of care. And they've started up some of these across the province. Oshawa is running a fantastic continuum of care as well. So they'd be a good one for you to reach out to. So we don't have it in writing yet, and that's what we're waiting on. But the province has verbally said they are going to take step one and invest in detox. So we know we need detox, but it's got to be a facility big enough. There's got to be enough beds. There has to be far more beds than there are the people that are in detox, because it's that transition of care. You've probably already talked about all of that already. And then it just continues on from there. So it's that initial onset of the detox, getting into a bed afterwards, providing that transitional housing as well. So more transitional housing. The province is committed to working on an entire program with us, verbally saying, you know what, we'll use Belleville as a pilot. What we've said is that's great, but we don't want to be alone. We're not the only ones. We're just the ones that stepped out and said, hey, we've got a problem here, and declared that emergency. But there's other cities that have been struggling much longer. In your area, we know that you've been struggling. City of Peterborough has been hit hard for a long time. Kingston is, they're suffering as well. So we're all in this together. And as this continues on, we'll definitely be willing to share anything that we can. I'm not the expert. I'm just the emergency manager, and I happen to look after that for the city. And I'm sometimes the spokesman for the mayor on this topic, but I can put you in touch with the right people. So if there's anything that anybody has any questions on, please fire away. I will either tell you straight up I don't have the answer, or I can get it for you. Like I said, I'm not a professional in drug addiction. I'm not a professional in mental health or in homelessness, but we all play our part in it. And I'm just one cog in the machine. I've got a huge number of staff that deal with this day in and day out.
Right.
They do suffer from the fatigue. Our police, they suffer from the fatigue. Our EMS suffer from the fatigue. We feel for them. We're investing in them. Right now, our city, I think I mentioned it early, $20 million. $20 million of tax dollars is what we're investing into, in some form, drug addiction, mental health, and homelessness. That
Yeah.
is not provincially funded. That's just our own city tax dollars.
Right. And Dan, that's like, to me as a regional councillor, not to compare, but there's this City of Guelph came up with this concept called the PIL, Provincial Initiative Local Levy. And it's like what's being funded by the local municipal tax base that really should be provincial responsibility. And our latest number was $180 million in the last tax levy, and 20 million for a town the size of Belleville is massive. So that's why I thought it'd be interesting to hear, because in the province of Ontario, there is this ongoing discussion about whether there'll be funding for more consumption treatment sites, or what is the province going to be helping to fund. We have emergency beds and hospitals closing. So it'd be interesting to follow along what happens in your situation. As you say, nothing's been put to paper yet, but hopefully we'll hear about some good news that way. So Dan, listen, thanks for coming today and sharing that. I find it quite illuminating, and I probably will follow up with you in the months ahead to see how it's going, because all municipalities across the province are looking for ways to get some extra help in our communities. So thanks again also for making yourself available. I really appreciate you coming. So I'm just going to wrap this up. I want to thank everyone. It's near that 8:30 hour. I want to thank everyone that came out today. I want to thank all of our speakers. I know they were kind enough to adhere to this 7 minutes that this guy from Waterloo Region asked out of the blue, asked them to do. I call it mini TED Talks, and I think it was very interesting, and I really appreciate it. For me personally, as a regional councillor, I'm a personal injury lawyer by day, counselor by night, and I'm trying to get myself up to speed on these issues, and all your information helps make me a better counselor, helps better educate me, and hopefully the people that were tuning in today also came away with some valuable information. All the best to everyone from coast to coast. Take care. Bye.